Welcome to this video on kidney disease. We have divided this video into 4 different sections for convenience. In the first section, we deal with the nature and reason for the disease. In the next, we look at the latest developments in medicine and kidney disease treatment. In the third section, we look at the comorbidities, complications, etc. that are usually associated with kidney disease and the role of lifestyle correction in kidney disease management. In the final session, we actually see how clinically supported lifestyle correction helps in managing and overcoming kidney disease. To begin with, the first question is regarding what is kidney disease and what are the different types.
Kidney disease usually are two types. Generally, we can divide the kidney disease into two types. One is acute, that is fast progressing. Within a week, the kidney will fail and there will be symptoms of discomfort and we'll be able to diagnose it early. But in the chronic, it's a chronic disease only after 20 or 30 years only. It will end up with the renal failure. That is the most common actually. In the acute renal failure, usually because of the dehydration with the diarrhea, vomiting, or blood loss. That is the most common reason for the acute thing. And also next is the toxins like snake venom, snake bite, or even antibiotics, chemotherapeutic agents, even the contrast dye which is used for this diagnostic procedures like angiogram and some of the CT scan, MRI, etc. This contrast dye is used. So it can also, if the patient, especially the patient is having some undiagnosed kidney problem, it will be manifesting as an acute renal failure in that stage. And another thing for the chronic renal failure, when we come into the chronic renal failure, it is basically the lifestyle disorders like metabolic disorders, basically, like obesity, hypertension, diabetes, which will be chronically damaging the kidney and the disease, and also the medication which is using for the disease will be chronic, affecting the kidney and leading to chronic renal failure. In that, another most important is autoimmune diseases like this SLE and IgA nephropathy. If at all they are diagnosed, SLE usually diagnosed early because it will be very symptomatic. Patient will be having so much of problems, and with the diagnostic test, SLE will be diagnosed, and usually look for the kidney function also. But usually the SLE also only after 10 or 15 years, if they are under treatment, only 10 years or 15 years only the kidney failure will come. And in that also the medication which is using for the controlling the symptoms will be contributing a big role in ending up with renal failure. Another thing is congenital problems like polycystic kidney disease. That is all family run also. Here also the important thing we should all understand that the kidney failure, there's no medication. But it all connected with the lifestyle. If you diagnose early, then you can correct your lifestyle, you can prevent a renal failure. Even this congenital polycystic kidney disease also, it can also be, if it is early diagnosed, if you control other lifestyle factors, like you prevent obesity, reverse diabetes, hypertension, all these things can help going in delaying and also even preventing and delaying the renal failure.
Actually, when you talk about kidney disease, what happens is generally it is felt that there aren't any much symptoms initially, so it is like a silent killer and all that. But even then, it will be good to know or check out if any symptoms are present. If you can explain in a few words about what are the common symptoms and also why it is said that diagnostic tests are the only real way of checking out for kidney disease.
In the kidney disease, only at the end stage the symptoms will appear. That is generally the fifth stage, GFR less than 15, that stage only usually the symptoms appear. That symptoms will be, some patients will come with only with the starting vomiting. Then the creatinine will be 10 or more than 10. Then before that, they are not aware of the problem. Only in that cases, if you check the blood only, you will be able to understand. But we can, this general, a few symptoms we can say is generalized tiredness and also edema, especially the puffy face when you are getting up. And also low in pain, that is low back pain on the sides. Usually central, it is the vertebral pain, but it is the side of the vertebra on either side, right and left is the kidney. And if that part there is pain, then also you should think of the kidney problem. Then any urinary infection or the color changes in the urine. If there is bloody discoloration in the urine, blood or the darkness of the urine, that can be a sign of the bleeding into the kidney or problem. And also frothy urine. When you pass urine, it is froth formation is too much, then it can be because of the loss of protein in the urine. Especially usually most of the diabetic patients and the hypertensive patient, if it is developing, that means it is nephropathy. Another thing which can show the kidney health is the darkening of the face or the cheek and the forehead and all. That is usually happens with those having diabetes, hypertension or high cholesterol. That means that is affecting the kidney or the liver. Either of this organ is affected. So that also everyone who's having a darkness developing in the forehead or the cheek or any other part, there will also, and also unnecessary itching and dark patches on the leg or any other part. The skin disease, because skin and kidney is very closely connected. Both are respiratory organs. So manifestation, kidney disease can manifest on the skin also. So in that case also, we should look into the kidney function test and find out the finalization or what is, we can more elaborate only with the investigations we can see or it can come into a diagnosis.
Generally, patients see the kidney as an excretory organ only, basically related to urine. But what we understand is kidney is related to many different systems and organs. Can you highlight what is the importance of the kidney with respect to the circulatory system?
We think that generally people will think that kidney is an excretory organ. But it is not simply an excretory organ. Actually, kidney is controlling our blood volume and blood pressure. So almost all the medicines which is given for the blood pressure control, it is acting really on the kidney. And so the blood pressure control, kidney is having an important role, blood volume control, and the hormone management. It is producing many hormones, and it is many hormones produced by the other organs in the kidney. Is also the actual site of action is in the kidney tubules. And another thing is erythropoietin production. Hormone erythropoietin is produced by the kidney. Even the kidney, the filtering volume of the kidney, the kidney is actually around 250 liters of blood is filtered every day. So that much of blood is flowing through the kidney. So we should understand that kidney is not just an excretory organ, it has so many other functions, which is actually hemostasis, that is of the overall control of the excretion and the blood volume. Everything is have a very major role in the for the kidney.
Just like this relationship between the kidney and the circulatory system, regarding this hormonal influence on kidney function and the general endocrine system of the body, it seems to have a very big connection. Because in general, people and patients should know what is the importance of the kidney with respect as an endocrine organ. So what is there to add in that?
Most of the hormones produced by the other endocrine glands and also the kidney produced hormones. Kidney is actually producing mainly three hormones. One is renin. Renin, angiotensin, aldosterone metabolism, aldosterone. that is angiotensin is produced by the liver, and aldosterone is produced by the adrenals. This is controlling the blood pressure, and also other hormones like one hormone produced by ANP, hormone produced by the heart muscles, and also another hormone produced by the pituitary, ADH. This also finally acting on the kidney actually. That is also has a major role in the BP, blood pressure, and the blood volume control. Next is calcium metabolism. For that, we all know that vitamin D is important for the calcium and the bone strength and everything. And the final most active form of the vitamin D, the calcitriol, is produced by the kidney actually. And another more important thing is erythropoietin. Erythropoietin is controlling the RBC, red blood cell production, in the hemoglobin. The blood's oxygen carrying capacity is decided by the kidney mainly. So this we should understand that many of the hormones is acting on the kidney, and the kidney is producing at least 3 hormones, and there may be other things which we are not yet found out.
Actually, when we are talking about this kidney disease, generally people don't get to the picture of this gut-kidney linkages. But at the same time, it is said that this gut and kidney are very much connected, and any problem with one can affect the other, and vice versa. So what is it that we should know about that?
Gut health and the kidney has very close relationship. The most important is actually our body is the result of the food what we eat, and many food which may not be suitable for our body. For example, this gluten, we are all hearing about the gluten allergy. Gluten is a protein which is commonly found in the wheat, oats, rye, etc. So if that is taken, initially actually celiac disease we have diagnosed, that is an intestinal disease which is debilitating, which is if the patient will develop diarrhea and emaciated and all. Actually the celiac disease and the connection with the this gluten is found out in that first actually. The later we understood that the gluten has so many other side effects like non-celiac other diseases also, even that has psychiatric connection and all. When we are considering the lifestyle, that is the most important actually. The what food which is ideal for the person. It can, if the food is food is the immune system is reacting to certain food. I have seen patients with which is not tolerating rice. It's in Kerala, the major food is rice, and rice intolerance, wheat intolerance, milk, egg. And even the vegetables like the very harmless vegetable like lady's finger or a lemon. There are people who cannot tolerate such things. So understanding that also is very important to protect the kidney. Next is the intestinal diseases as such. That is the problem. Initially we talked about the food itself, whether it is suitable for the person. Next is gut health. Leaky gut. That is, if there is a abrasion or ulcer or inflammation in the gut, the gut content, we know that the gut content is containing so many bacteria and undigested food. This is very unhealthy. We see the feces, the excreta is very unhygienic, and so much of bacteria and viruses and all is there. So it will get a free entry into the bloodstream. So that, and also the toxins entering in the bloodstream will give an impact on the kidney. That is the reason when after a food infection, the kidney can go into failure. And also those patients with the chronic gut disease like ulcerative colitis or Crohn's disease or gastric ulcers, they can get a kidney disease also. In those patients also should look for the renal function and see what is the level of the kidney function, because the kidney will start complaining only in the very late stage. So we should recognize it in the early stage itself.
Actually, nowadays these autoimmune diseases seem to be more rising or are being identified in a larger scale. At the same time, we understand that these autoimmune diseases have a definite impact on the kidney health and kidney disease, and and also with respect to toxin clearance and all the associated problems. So, what is it that those who have autoimmune diseases should know with respect to their impact on the kidney health?
See, autoimmune diseases which directly impact on the kidney is one is the IgA nephropathy, and another is SLE, systemic lupus erythematosus. The IgA nephropathy usually will not show any symptom at all. It will be getting symptomatic only at the end stage, stage 5 only, usually it will manifest. That is, I had seen patients 35 years or 27 years, they're diagnosed with the renal failure at the end stage only when they're admitted with an OMT. And when in the investigation, the creatinine is 10 or 12. So that is one type of autoimmune disease. Another is any autoimmune disease which is affecting the skin, liver, or intestine, which can have an impact on the kidney also. Because these four things are working together for us an excretory organ also. The skin is an excretory organ. It is making waste is expelled through the sweat and even the soil, sebaceous glands. And the liver is actually major excretory organ. If the liver is affected with the disease, autoimmune disease or any other disease, it will increase the workload of the kidney. If the skin is affected with very common skin diseases like psoriasis, eczema, and so many autoimmune diseases which can affect the skin, and it will also make an impact on the kidney. And the intestine, this mucous membrane, that is the internal covering layer, we call it as mucous membrane. The large area is there in the intestine. That if it is affected, that is inflammatory bowel disease and all, it will also affect the kidney. So if any of these diseases are there, we should definitely look into the health of the kidney also, GFR. We should look into that and see what is the kidney health. And another thing is the medication which is used for this autoimmune diseases, like very strong immunosuppressants we are using for that. Even the antimetabolite, that methotrexate, is very commonly used for this psoriasis and rheumatoid arthritis. This all can create problem for the kidney also. And there are other more stronger. I have seen patients who are using 3 or 4 immunosuppressants, which has finally the patient who is diagnosed with SLE and 20 years or 25 years, within 15 or 10 or 15 years, kidney failure will also come. That is because one is the disease progression and the other is the medicine toxicity. Actually, all these diseases comes under the lifestyle disorders, and it is actually because of the toxins entering in our body. Actually, because any medication also is considered as a toxin. Even the heavy metals, we know that pollution is increasing. The air and water and food also polluted. Nowadays, it is hard to find any food without food additives like color, preservatives, coloring agents and all. It's all increasing our toxicity. That is the reason for increasing the autoimmune disease, and definitely it will increase the renal failure also, chronic kidney disease also.
Generally, this chronic kidney disease, when we generally hear about it, it is something like, it is a progressive and irreversible disease. That is the general approach. So in case someone has a beginning of chronic kidney disease, then wait and see, we'll see, because in case something happens, we will go for dialysis, and that way it is seen. But at the same time, we also hear, no, it is not that, chronic kidney disease is something that is right off, that you have to go towards dialysis or towards renal transplant, kidney transplant. So, what is the truth?
See, in the modern medicine, we think only about, we think what can be done with the medicine, what is cure in the medicine. Patient is asking, give me medicine, doctor, I have this. But we should understand one thing. There is no disease can be, especially this lifestyle disease, for the kidney disease, there is no medicine to treat a kidney disease. Only when you are failed And when it is stage 5, we can think of a dialysis, that is artificial kidney. Actually, this dialysis machine is an artificial kidney. It is taken for 1 or 2 hours a day for filtering, and that also it's only partially. It is not artificial fully. It is only an excretory function. That also it is not doing and in the way the real God-given kidney. So even with the this renal function test, there is a mismatch that usually if it is only in the 3rd stage, but after only the GFR reduced less than 60 only, it will show that is creatinine is higher and abnormal. So that has to change. That is internationally it is done. In many of the renal function tests also, they don't mention about the GFR. That is the earliest we can diagnose kidney disease. And even the doctors who see that also won't comment about it to the patient. Why? Because there is no medicine available. Then why should we tell the patient and make them worry? That is the attitude. That has to change, because in my experience, if it is an early stage of the kidney disease, if you are diagnosing the 1st or 2nd stage, it is very easy to reverse the kidney disease and bring it to the GFR to above 90. It's the normal state by lifestyle correction, not by medication. We should understand that. For that, we had to understand that this lifestyle correction, if it is properly applied, even I had patients who had creatinine has increased to, if it is increased up to 8 and all, it has come down to 4 and all. So it is again, it's advised. There are many patients I had managed that asked for dialysis or renal transplant, but they are maintaining their health without dialysis and this after only dialysis we'll think of the renal transplant. So without going for the dialysis, they are able to manage without that. But depends on the stage. If you are getting the patient in the 3rd stage, we may be able to bring them to grade 2 or grade 1 or normal. But if you are getting it in the grade 3, 4, then maximum to 3 usually. It should not be bring it up to the normal. Then if it is in the grade 5, it is grade 5, it can be a BC, different levels. The early stage, it may be able to bring up to the 4th stage, but in the late stage, we can bring into the clinically normal stage for some time. That's all. So it is. We should understand that kidney disease can be reversible to an extent, and also it can be maintained in that way, reverse in some extent, and maintained in that way, provided the patient is willing for the lifestyle correction.
Actually, in the case of what you said now, actually the patient has a big role in trying to understand what is his or her status and then deciding on how to go about the treatment in the future. Generally, we see that when a patient gets a chronic kidney disease, then you advise that the patient should look back in his life or her life and try to figure out what was the primary causes that may have created that situation. So, what is your experience with that?
See, basically, the obesity, diabetes, hypertension, heart disease. Heart disease means dyslipidemia. That is, the blood vessels are clogging. Blood vessels are clogging the heart disease, and the heart blood vessels, we take it as heart disease. And stroke, and if it is clogging the brain, blood vessels supplying the brain, you will get a stroke. If it is in the heart, you will get a heart attack. If it is in the kidney, blood vessels are clogged, you will get kidney disease, kidney failure. So it is all, these 4 things are the most common. And next is the autoimmune disease. And there is some familial also, even that polycystic kidney disease, that's a familial disease. But that can also, in all these diseases, even the familial polycystic kidney disease also have a major role for prevention and maintenance, or if it is diagnosed, we can lift the kidney function to some extent, and it can be maintained provided if the patient is willing for the lifestyle correction.
Generally, what are the common diagnostic tests used to confirm kidney disease?
The renal function test, that is a blood test, and also urine test. It can give a basic idea about the kidney disease. And it depends on, again, although the staging is mainly by the GFR, glomerular filtration rate. And next is ultrasound scan. That is also harmless, usually. I'm talking about the least troublesome test. So ultrasound test will give an idea about the kidney status, and also the any abdominal scan we can do, and also there is any stone or anything we can find out. Then if your more test is needed, the CT scan and MRI is there, and also the biopsy. Final diagnosis, especially for this autoimmune diseases, biopsy can also be done. But usually this invasive tests are not usually needed actually. We can, with the modern diagnostic facility, you can, this blood tests and all, we can otherwise also, because kidney is already weak, and then why should we give any injury with the biopsy also. And also this CT scan, and usually give radiation. And always think, if you have a kidney problem, don't use contrast dyes along with this. And you should always, if ask the doctors also whether they are using contrast dye. It can definitely deteriorate your renal function.
With this, we come to the end of this first segment, where we dealt with the causes and reasons for kidney disease and the diagnostic tools available now. Thank you.